Okay, so I'm going to make this quick video to go along with your section on the first aid video about anaphylactic reactions. So anaphylaxis is when you have an allergic reaction that is severe. So what your textbook, the DHO textbook, calls that is an injection poisoning. And that's because that poison has been penetrated into through your skin. So examples would be insect bites, spider bites, snake bites, or stings. So what you would do if you have a localized bite or sting is position the affected area below the level of the heart. For an insect sting, you want to, if there's a stinger, and you're going to see this later on the American Heart Association video, but if there's a stinger, you want to scrape away from the skin like the edge of a credit card or some type of ID card. My ID card would work. Just scrape away from the skin. You don't want to use tweezers because what's going to happen is that stinger actually has a venom sac that can press more venom into the tissue. You also want to wash the area with soap and water and then put on some kind of covering. It says sterile dressing. A Band-Aid would be appropriate sterile dressing for an insect bite to reduce the swelling. Tick bites, we'll talk about those later. The reason that we talk about injection poisoning right now is because you just talked about severe allergic reactions on your video. So the reason I came on was because I wanted you to see what happens with an allergic reaction. So right here in your text, let's see if I can get your attention there. It says for any type of injection poisoning, you're going to have to watch for an allergic reaction. So signs and symptoms of allergic reaction, a severe allergic reaction, are redness and swelling at the site. Then you can also develop itching, hives, which are whelps on the skin, and they whelp up and they become red. And eventually, if the person is really having a severe allergic reaction, you're going to see swelling of the throat, which will lead to labored breathing. Eventually, they'll have dizziness, and then they'll have a loss in the level of consciousness because they're not getting enough oxygen. So what you need to do is maintain respirations. I just wanted to get through the written part. Obtain medical help as quickly as possible. And so this is just what's going on in the body to let you know. So first of all, you have the bee sting and it triggers the allergic reaction. So inside of the lungs, this is what's happening. This is the tube where your air goes through. So when you're breathing in, it comes through the larger tube, the trachea, down into the bronchi and then to the bronchioles. So what's happening inside of these tubes is you're having severe inflammation, which is causing a very narrowed airway. And so that is why the respirations are so labored, because there's bronchial constriction. And remember, constriction is getting small. So the inside, the tissue inside of those tubes is becoming inflamed and causing bronchial constriction. This is a picture of what hives would look like. And they could be on the arms, legs, trunk of the body, the face. And you're also going to see with an allergic reaction is a low blood pressure. And that means that blood is not perfusing or getting to the major organs of the body, to include the brain. So it's very important that you treat an allergic reaction, that you recognize it, that you treat it. If the person has an epinephrine pen, then you want to use that. You also want to call for emergency responders because that person could lose their airway and could die. I wanted to show you our EpiPens that we have. So these are trainer EpiPens, which means they don't really have a needle inside of them. We have a couple of different types, so you can see that there are different brands, but they're all similar. So an EpiPen has a spring-loaded needle that is strong enough to go through clothing to be used. So it has a safety cap. So if I'm trying to activate this pin, I can't because of the safety cap. So you need to pay attention. Most of them do have instructions and pictures. They also, like I said, have the safety cap. So the safety cap is going to be the not needle end. So when you take off the safety cap, that's the end that you want to put your hand on. Okay. If you put your hand on this end and then you press, the needle's going to go into your thumb. Okay. So this is the way you hold it. Whichever end you just took the safety cap off of is the end that you're going to put your hand on. Okay. You have to use enough pressure to activate the pin, the spring-loaded needle. This one's not working right. And this one doesn't do what the other one does. It's a different model, but you're going to hold it into place. You heard it click, so you know it's working. And we reuse these because, once again, they are trainers, but if you used it on a real person, then remember that there really is a needle. And you need to discard this as appropriately. Also, mark the time on here when you gave the dose. A lot of times people will have a second pin, and you need to stay with that person. You can't just assume that they're going to be okay. This is the second type of pin that we have. This is the kind that you saw in the video. A student of mine taught me that her doctor taught her blue to the sky, orange to the thigh. And so orange is usually a caution color. So the orange is the side with the needle. So when you use this one, you're going to do orange, blue to the sky, and then orange to the thigh. So I'll stand up and see if you can see. This is where you would give that injection. You want to be right in the middle of the thigh, and you give it just hard enough to hear the spring load. You're going to hold it in place for about 10 seconds. Some of the newer models you only have to hold for 3 seconds because for children it's really hard to keep them still that long, especially if they're struggling to breathe. And then you want to, either you or the person will rub the site for 10 seconds. And you want to rub it pretty hard because you want to disperse that medication. So once again, this would have a needle in it. You would mark the time of the injection, and then you would give this to EMS because you called 911. You would give this to the EMS team so they could dispose of it in a sharps container. So we will be checking off on epinephrine pen injection. Since ours are trainers and they are reusable, we just reload them for the next use. So that's how it works. Also, there are images that I will show you. I'll just look it up because you can get a laceration, and I want you to be aware. So this is why you really want to, you don't want to be too forceful with your injection. And you also want to make sure that you're hitting right in the middle of that thigh. Maybe we'll see some pictures. Here you go. So you can see how it accidentally dragged across. And sometimes, especially on a child, and sometimes you can have to have sutures for it. So it is something that you want to make sure that you have the person be still for, and that you hit where you're aiming instead of just dragging that needle across and accidentally. Okay. And that is all I have. For some reason, I'm not finding the pause button. Okay, so for the rest of this period, you'll be working on your first aid book. I did give you some checkoffs that a checkpoint for this week that you should have finished. If you have questions, you can email me. You can call me on Thursday, but I won't be available on Wednesday, obviously. And you also have a remind code that you can put in to contact me. Thank you.